Enabel, the Belgian Agency for International Cooperation, has donated a range of high-value medical training equipment to Jinja School of Nursing and Midwifery, Hoima School of Nursing and Midwifery, and Fort Portal School of Health Sciences. The support package procured under the We Train for Health project includes a backup generator, ICT equipment, waste management bins, toolkits and advanced skills lab equipment designed to equip learners with hands-on competencies needed in modern healthcare.
Very good health service in Hoima. It's a big city, so please make sure this equipment is exactly that.
Presiding over the handover, Canon Dr. Kedris Triagenda praised the Enabel for its continued partnership, noting that the We Train for Health project has significantly improved the quality of training at beneficial institutions.
We Train in Health is meant to help us as a country improve our health service delivery. The health service delivery is done through our health facilities, health centers at various levels, hospitals and referral hospitals. And this is done well if the people who work therein, as nurses, as midwives, as clinical assistants, as doctors, have the right competencies, values and attitudes and ethical, and love their country and love the people they work with. So we have been here as a committee composed of all stakeholders, and we know that progressively we shall get the quality, trained, positive workers in our health services and improve those services therein.
She highlighted the ongoing government efforts to sustain the project for the next 5 years and reaffirmed the ministry's dedication to supporting healthy training institutions in order to enhance healthcare delivery across the country.
Each of these institutions has been encouraged, required to come up with what they call a plan for investment and improvement of their own financing. But also as government, we are committed to improving the health of our people, because we know it's the healthy nation, a healthy population that can be productive and enable us to have the development we need and the transformation we need. So as a country, we will continue to supplement whatever would have been left out.
Dr. Kedris also explained the criteria used to select institutions benefiting from the We Train for Health initiative.
Usually, they look at all institutions of the type they want, and then they look at which institutions have already received help in some other projects or programs, and which institutions, for example, have very high enrollments, have very high, catchment areas. So a number of things are usually put in to finally agree that since there are 20, let's take 3 for now.
Mubiru William, the program manager at Enabel, outlined the motivation behind the investment, emphasizing the need to bridge equipment gaps and strengthen practical training environment.
This support, on top of other support which we've given before, ICT equipment, but also in terms of capacity development, which we are conducting in partnership with the Ministry of Education, we feel that these institutions will be a better place for the students to be, but also contribute to the overall mandate of human capital development, which is part and parcel of the government program, especially the National Development Plan 4, which focuses more on human capital development.
He further revealed that the donated equipment is valued at 1.2 billion Ugandan shillings.
These equipments are worth 1.2 billion Uganda shillings worth of investment, and we feel that the institutions and the ministry will be in position to sustain them, maintain them, but also have them improve the learning environment of the students.
Kate Commander, Principal of Fort Portal School of Health Sciences, commended both Enabel and the government for creating a more conducive learning environment for future health professionals.
Enabel, we have had several trainings which help also in equipping the staff in capacity development and governance. I want to appreciate the Government of Uganda for putting the enabling environment where development partners can come on board without any hindrance and interference from the political hiccups.
Students also shared the positive impact the new equipment has had on their training experience.
When we reach at the hospital and we get a patient with asthma, we shall be able to manage. Plus, we've received a generator. Most times, we always have power blackouts. So we've gotten a generator from Enabel, and I believe it's going to help us because sometimes we want to study until late in the night and then we have power blackouts, but we are lucky we've gotten a generator.
By investing in modern skills, lab infrastructure, and strengthening accountability system, the We Train for Health project aims to create safer, more effective learning spaces, ultimately building a resilient health workforce equipped to meet Uganda's growing healthcare needs.